The week ends with nearly 90,000 Americans dead due to COVID-19, and states that have struggled for weeks with testing are now struggling to reopen. It's a nation uncertain and divided. Governors are clashing with state lawmakers and in need of cash. Neighbors are helping one another, but also arguing over face masks. Millions of households are dealing with personal tensions and financial pressure. Federal Reserve Chairman Jerome Powell said this week that the country is in the middle of the biggest shock our economy has felt in modern times and possibly facing an extended period of weakness. And here in Washington on Friday, House Democrats are considering Speaker Nancy Pelosi's $3 trillion relief package, but it's only the opening bid, with negotiations with Senate Republicans and the White House just beginning. President Trump, he's encouraging states to reopen and touting efforts to develop a vaccine.
There's never been a vaccine project anywhere in history like this. And I just want to make something clear. It's very important. Vaccine or no vaccine, we're back. And we're starting the process.
But health experts warn this week that the president and governors must move slowly. Here is Dr. Anthony Fauci and whistleblower Dr. Rick Bright, a former vaccine official.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history.
Joining me are four reporters who have been on the beat all week. Weijia Jiang, White House correspondent for CBS News. Jonathan Lemire, White House reporter for the Associated Press. Phillip, political correspondent for CNN. And Jake Sherman, senior writer for Politico and co-author of Playbook. Weijia, you're at the White House tonight. You're talking to sources inside the West Wing, looking at that testimony from Dr. Bright and Dr. Fauci. Is the president listening, or is he sidelining experts?
Oh, Bob, it's great to be with you, and I can tell you that this really was a 1-2 punch for President Trump, because you have these top health experts undermining his argument that the country is ready to reopen, an argument that he took a step further just today, saying that with or without a vaccine, we are back. And because the president does not offer scientific data to support his side of this argument, he turns to attacking Dr. Fauci and Bright. And so we heard him say that Fauci is trying to play both sides here, and that Bright is just a disgruntled employee who shouldn't be working for the government at all. And so this really struck a chord for President Trump, who at the same time is having these events trying to prove to the country that we're ready to move forward, when these experts are saying, if you do that too quickly, it will cost you.
Abby, what's your read, your reporting tell you about the discord that's possibly going on inside the task force? I saw Dr. Fauci standing behind President Trump today in the Rose Garden. What's the story behind the scenes?
Yeah, well, Operation Warp Speed, what they announced today with vaccines, is something that absolutely has to happen, and I think everyone's on the same page about that. But there's a real difference of opinion about how quickly the White House should be emphasizing reopening versus encouraging states to use data, as Weijia pointed out, to rationalize why they are reopening and how. Remember, just a few days ago, the White House had rolled out these guidelines for states to use in order to decide whether or not they could be phased into different parts of the reopening. Based on the way that President Trump is talking at the moment, it seems that they have virtually abandoned that framework. Many of the states are clearly not following, and there is a general lack of guidelines coming from the White House and from the CDC and other federal agencies about what should guide states as they reopen. This is being led by the president and a lot of his economic advisors, who want to focus on reopening, while some of the medical experts say there needs to be a slow, steady, and data-driven approach to this issue.
Jonathan, Abby just mentioned Operation Warp Speed, this vaccine effort inside the White House. It's being helmed in part by a former pharmaceutical executive. What's the reality here? What are the facts about how long a vaccine could take?
Bob, first of all, it's great to be here. Yes, Operation Warp Speed, with apparently an appropriate Star Trek reference on the same day they unveiled the Space Force flag in the Oval Office, is meant to be a crash course to develop a vaccine. And the president has taken to saying in recent weeks that he believes, and he said it again today, that he believes that a vaccine can be developed and widely disseminated by the end of the year, which is an extraordinary accelerated timetable. Now, members of the task force, his new vaccine czar, echoed that, said it would be a challenge, but he believed it could do it. But other health experts, including Dr. Fauci just the other day, really cast doubt on that, a real bucket of cold water. The vaccines often take years to develop, and Dr. Fauci has said he believes this one could be a year to 18 months, and even that would be an aggressive timetable. But the president doesn't want to hear it. He, of course, is looking to get the economy going as quickly as he can. He wants these states to reopen, and he's doing it with one eye, of course, towards November. He knows that in order to be reelected, odds are his advisors believe he needs to show that the economy is moving again. He and his team saw the dismal unemployment, historic unemployment numbers from a week or so ago. They're rattled that it could take quite some time, even with states beginning to slowly reopen, for some of those jobs to come back. And he feels that pushing forward this sort of very rosy take on the whole scenario, but particularly vaccines, is the best way for him to be, as he's put it, be a cheerleader for the country.
And Bob, if I could just add that,
sure, please do.
I think, when I talk to administration officials who have crafted, this new initiative, they're really trying to buy time when it comes to manufacturing and distributing. They said, look, it's like if we're betting on a horse in a race, we are going to bet on a few horses, a few promising vaccines, and start to manufacture those even before one emerges as a winner, so we'll be ready to, push it out and get it to the people who need it. The problem is that you can't rush the actual development part. There are about 100 different groups around the world that are racing to try to get something that they know is effective and safe, and that's the part that doctors say, you just cannot control when it comes to a timeline.